Welcome to the JACC Edge podcast. This is your host, Pratik Doshi. I currently serve as the editor of the JACC Edge monthly newsletter, where we do a deep dive on hot topics in cardiology in an innovative and engaging format. Today, we are lucky to be joined by two rising stars in cardiology, Dr. John Tanaka and Dr. Jena Pizula. Dr. John Tanaka is currently a third-year internal medicine resident at Duke University Hospital. His clinical interests include interventional cardiology and clinical outcomes related to peripheral vascular disease. In his free time, he enjoys scrambling to make a double bogey and a good West Coast IPA. Dr. Pizula has a background in medicine and pediatrics. She's currently an adult cardiology fellow at USC, where she's worked with research and med ed initiatives in cardiac and maternal health. She'll be joining the faculty up at Stanford this fall to continue her work in cardio-obstetrics. Thank you both for joining us here today. So to kind of jump into it a little bit, can you guys both give us a one-liner about yourself, just who you are and what you guys like to enjoy outside of medicine?
Yeah, thanks for having us. This is awesome. I really enjoy your podcast. I am currently a third-year fellow at USC. My passion is cardio-obstetrics, and so when I'm not in the hospital working with maternal health, our cardio teams and our MFM teams, I'm surfing. I'm born and raised in Southern California. I was on a surf team in high school, so doesn't get much more California than that. And then vegan cooking, so a healthy, active lifestyle.
Awesome.
Yeah, and like you said, Pratik, I'm a third-year PGY 3 at Duke University Hospital, interested in interventional cardiology. When I am not in the hospital, I'm originally from Hawaii, so I also surf a little bit on the East Coast. It's not as good as Southern California, but like you said, love to golf, love to kind of be outdoors. I have a small dog that we take hiking and all those kinds of things. So it's awesome.
I've been surfing a few times, only stood up once, but probably highlight of my life thus far.
I love it.
So we're here at ACC. ACC.23 in New Orleans this year has been a really exciting time for all of us. While for some it's an opportunity to mingle with old colleagues and friends, for others this is the conference for ideas and information to be shared, exchanged here, and really drive healthcare and cardiology forward. And so we're really excited to have both of you kind of speak to your experience being here and learning from all these amazing faculty members and speakers. So to just kind of start us off, how has this experience been for you so far? Any specific exhibits or speakers that have or key learning points that you want to share with us and our audience?
Yeah, absolutely. I can actually say, for me, I think the beautiful thing about ACC is the connection, and I actually saw this on my flight out here. I sat in between sort of a leader in the field of interventional cardiology and a med student who really wanted to get involved in cardiology. This med student goes to a DO school, and she felt that she didn't have enough access to this field, and so that connection was made across me as on the plane, and I was like, this is exactly what we're here for, you know? I was kind of speaking to her about some of the people I knew and how we can get her involved, and then obviously this incredible faculty member was trying to get her involved as well, and so just seeing that before ACC even technically started, I was like, that's the spirit of ACC, and that was just so fun to witness.
That's awesome. That's amazing.
Yeah, that's actually what I was also going to say.
Tell us.
So I was flying in from Raleigh, Durham, and the plane was just full of people coming to ACC. Obviously, the only direct flight yesterday evening to New Orleans, and there's just people from all universities throughout the Carolinas on this flight, talking, collaborating, making new connections, telling each other about their research. I was trying to take a nap, but the people behind me were kind of making this connection, and I heard them exchange email addresses because they noted that they had a similar interest in cardiology. One was I think a resident, and another was a fellow, and they were talking about collaborating on future projects together. And I agree with you. That's the spirit of ACC, and that's what's so great about being here, is that you can go up and really meet anyone in a field that you're interested in. And I think that everyone here is kind and very much willing to, connect, meet each other through email, kind of, have some sort of further collaboration moving forward.
Yeah, absolutely. And I think that speaks to just the community overall. We are lucky to be surrounded by faculty members, residents, fellows, med students who really are here to learn and engage with each other, and also have that ability to converse, regardless of how established somebody is in the field or how new somebody is. And I think that's a really beautiful thing. Jenna, I wanted to specifically ask you, because this is the first year that I believe we've had a cardio-obstetrics event and reception. The JACC is working really hard to build that section out. And as somebody who's really interested in this field, how has that experience been kind of getting into cardio-obstetrics? And any resources that you can share for students who might be looking towards this as a potential option?
Yes, definitely. I think this is an incredibly exciting time for cardio-obstetrics. even starting off at 8 a.m. this morning, JACC Advances had a really awesome session where they were discussing the emerging subspecialties within cardiology. And these subspecialties, the need has always existed. There's always been good-hearted cardiologists who have been attending to these patients, but the push now is to codify that expertise. And Dr. El-Kayem, who's kind of considered the grandfather of cardio-obstetrics, put it really well in his lecture this morning. He said, making this a subspecialty for cardio-obstetrics is key because there's a heterogeneous patient population. There's such a variety of diseases, and not necessarily the numbers that you would need to feel confident treating such high-stakes patients are you going to come across in your general fellowship. So the making it a subspecialty, putting the resources to it, encouraging research and push the field forward, that's where ACC has really helped. And I think by making it a section, all of those initiatives are going to go forward. And the biggest thing for me is for every 100,000 live births, over 22 women die in childbirth. So we have sort of horrifying statistics for maternal mortality, and the number one reason women die during pregnancy is cardiovascular disease. So having a subspecialized team that can take care of these women, and it's a multidisciplinary team, but cardiology is a huge leader in that. Actually, the American College of Obstetrics and Gynecology, ACOG, says that at minimum, a cardio-obstetrics team needs to be an obstetrically trained cardiologist, plus an MFM, a maternal fetal medicine specialist, plus an anesthesiologist. And obviously the team should be much larger, social workers, case managers. And I think in making this a subspecialty, making this a training pathway, giving it a section within ACC, that's how you're going to achieve those high-functioning, high-quality teams to do the work that's important to reduce that mortality.
And I think you bring up a couple of interesting points. One, specifically, that for cardio-obstetrics as a field, you can't just rely on cardiology. You know, it does have to expand beyond that. It has to include other staff members, social work, case management, but also other physicians who are well trained in their own specialties, anesthesia, cardiac anesthesia, and MFM. So, you know, having opportunities to have that type of collaboration is really, really critical. And I'm glad that ACC and the field as a whole, and the community as a whole, is really working on putting that together. Can you tell us a little bit about how you kind of came into cardio-obstetrics?
Yeah, definitely. My background is a little unique. I did internal medicine and pediatrics, and so I love working with people who have an illness that they might have developed in childhood that they carry with them into adulthood. So in general cards, I did a lot of ACHD. Somehow my panels would fill up with ACHD patients, much to the so a little bit of delight of my co-fellows, because those are very complex cases, and they require a lot of work. You have to get on the phone with imaging and explain what you're looking for. You don't just order an echo. You get on the phone with the echo tech and you explain, you know, I need to sweep through here, I need to look at this. And so these patients require a significant amount of, and rightfully so, a significant amount of follow through on their care. And so I got really attached to working with the ACHD population, but within there, we started to see a lot of women of childbearing age coming in pregnant. And that was it for me. I was like, this is amazing. Like, I want to contribute to lowering your mortality in this field. I love working with you. I love working with your growing family. I'm a pediatrician, so I love talking to mom about baby. It's a fun space for me to be in, and it makes going to clinic fun. And so that is kind of how I fell into it. I was very, very lucky to have Dr. Yuri El-Kayem at our fellowship. He literally wrote the textbook on cardio-obstetrics, and he's been a wonderful mentor. He has done a lot with the JACC Advances paper, and he's sort of made that a mecca for cardio-obstetrics as well, so sort of pushing the field forward with research. So having mentorship and then having that pediatrics background that led me to ACHD, that led me to cardio-obstetrics, is kind of how I started.
That's awesome. And I see JT here laughing because I think he hopes for a fellow like you in his fellowship. He's about to start.
No comment.
So, kind of coming back to cardio-obstetrics for a second, are there resources for med students or residents who might be interested, or even early career faculty members who might be thinking about switching or focusing their career a little bit more on this specific population?
Yes, and definitely I'm so excited to say now within ACC that definitely joining the section on cardio-obstetrics, that's going to be huge. But also there's so many players in this field. There's the Society for Maternal Fetal Medicine. They have some wonderful resources. There's ACOG, the American College of Obstetrics and Gynecology. So you've got all your professional societies. And then there's also a very large state national and global push from a public health perspective to reduce maternal mortality. So there's grants, there's initiatives, and there's need in all of those spaces. So I think it's, and also this morning there was a lecture on how to start a cardio-obstetrics program at your institution. So it's the resources are there. It's, starting any program is difficult, and this is something that is non-negotiable multi-specialty, and that carries its own challenges. It needs to be an MFM and a cardiologist seeing this woman. And so getting that up and running takes the elbow grease and working with your institution, but it's very worth it, and the outcomes have room for improvement, and a lot of good work can be done here.
Absolutely, and I think this is a really exciting time, and I think over the next couple of years we'll probably see cardio-obstetric fellowship programs or some training programs start to come about. To kind of switch gears a little bit, John, you're an internal medicine resident. You've been coming to ACC for a number of years, and it seems like these conferences are really important in terms of your training and kind of your decision to then pursue cardiology fellowship. Can you tell us a little bit more about how ACC played a role in that?
Absolutely. I think that ACC is a nice way of kind of coming together, meeting people that are like-minded to you, whatever your interest may be, and really getting into just kind of what fellowship looks like, what attending it looks like. Because as a resident, I think, or as a medical student, you're very in touch with what a resident's day-to-day looks like. You know residents show up at 7 o'clock or earlier, they round, they stay until sign out, and they do that over and over again because you're working with them on your medical school rotations. I think as a resident, there's so much just differences between individual cardiology programs that I actually thought that coming to ACC was a nice way of helping myself kind of gauge which program I actually would enjoy working with, talking and kind of introducing myself to different fellows who are from programs I was interested in through research, and then kind of asking them a little bit more about the program itself. So I did that last year when ACC was in Washington, D.C., and just kind of picked the brain of a few fellows who had posters up or who were kind of spending some time waiting to answer questions about their posters, and here I was asking them questions about their fellowship program, which may have been a bit of a relief. I think if someone asked me about my residency program, I'd be a little more relieved than asking me about my poster. But that was a really nice way of just getting an insight into what the day-to-day was, if they're, how they see themselves and how they see their programs lining themselves up for moving into attending time. And so that's I think a really valuable thing, being a resident, coming to these types of ACC-like events and networking with other fellows and also other people within kind of your residency itself.
Absolutely. And for our resident med student and early career listeners, are there ways or tips that you can share about how you navigate a conference at this scale and kind of how you initiate some of those conversations?
Yeah, it gets easier the further and further along in your training that I'm sure you would agree with that. Just because you start to make those connections and know you're sending off texts, who's going to ACC this year. I think early on when you're a medical student or when you're an intern, really trying to do that with the folks who are in your institution is a good first step. I know it's a little intimidating being a medical student and asking interns or any of you guys going to this conference, but I think it's a nice way. As a third-year resident, I would have no qualms with bringing a medical student with me, kind of showing them the ropes a little bit, because it just fosters that culture that we talk about, that we see at ACC, that very collaborative culture.
Yeah, absolutely. And again, I think it speaks to the community. It speaks to the fact that things are always developing and they're always open. Even this year, I believe there's a high school group that is here at ACC with us. So there's really this program of ACC mentorship. Is there any advice you can provide to maybe our mentors about how they can better support some of our trainees?
That's a really good question, and I think I can kind of rephrase that as a way of looking at it from a resident perspective. I think that one thing that we run into a lot as residents is that there are mentors who are willing and available and really want to help you succeed, but may not be the best fit for you. And that may be a timing thing, that may be a career interest thing, and I think from a resident perspective, a lot of the time we are scared to tell someone no, and I think that mentors need to be more, or can be a little more open about saying, if this isn't a good fit for you, you're not hurting my feelings, I totally understand. This needs to be a good fit from both ways. My mentors, I've been very fortunate, my mentors have been very open with saying, now's not a good time for me to take you on as a student. But I think that, if you run into an issue as a resident or a medical student where you have someone who really wants to help you, but the timing may not be there, I think that it would just be helpful for everyone for the mentor to be a little more open about that, because that's something that I see has been an issue for folks that I've trained with, where the fit just isn't there from a timing standpoint or an interest standpoint. Not that they don't get along, but I think just being open from both sides of that relationship.
Yeah, and I think that's probably an experience that every person who's gone through some sort of training program has had, where you're with somebody that you very much jive with, but often have trouble finding that career interest that matches. So I think that's a great piece of advice, and I really appreciate it. Dr. Tanaka, Dr. Pizula, thank you so much for your time. This is the JACC Edge podcast. We really, really appreciate you listening, and for more content from ACC 2023, as well as other hot topics in cardiology, please subscribe to our newsletter and follow us on Twitter. We hope to see you again next time. Thank you again.
Thanks for having us.